Hi, this is Dr. Pepe, and today we're going to be going over the NCE review. And we are in clinical focus, and today we are doing letter K, which is grief and loss. So, whenever you see the word grief or loss, please think of Dr. Kubler Ross's work and the different stages of grief. Most people can deal with grief when they have a significant loss. But for counseling, what you are wanting to notice is a experience of extreme distress that is prolonged, and they mention that they want help because they feel like they cannot control it. So for many people that seek counseling for grief, many times it's because of that prolongedness, this high distress. So one of the things that it's important to understand is one of the best predictors of distress is poor bereavement outcomes, which is some of Warden's work. So it's important to understand what that is. Bereavement outcomes kind of refers to how they, how they grieve, how they view loss, things like religion, family, rituals, customs. That's all really ties into that grief process and the intensity of that grief, right? And grief can mean several things. Grief can be associated with many different types of losses, such as divorce, moving, loss of a pet or of a loved one, and um, and that kind of affects the daily function. So for the process of counseling, some of the task of mourning is the acceptance of the reality of the loss, so not pretending like they're not there. Processing the pain. Many times there's a great deal of pain. There's a great deal of well, what if? Adjusting to the world without the deceased or the loved one, and then finding an enduring connection. So finding meaning while continuing with day to day living. So all of that is important in the counseling of someone that has experienced loss or grief. Um, Also, it's important to understand that part of increasing the reality of loss is that reality of not living in fantasy. So helping the individual understand the emotions as well as the behavior pain. And as Viktor Frankl said, making meaning of that pain, instead of it debilitating you, putting that pain into something fruitful or something meaningful. Supporting the client as they come, adjusting to obstacles and then readjusting, and then helping find ways of creating bonds and creating a meaningful day to day living. So, with grief, again, it's a very complicated thing, and there's a lot of different um, variances. No two people grieve the same, but it's important to remember that part of the healthy adaptation is mourning within a reasonable time frame. And again, that's very cultural dependent, right? Because what may be viewed as excessive in this culture may not be viewed as excessive in another culture. And then with grief and loss, it's important to understand how complicated and how different reactions can be. Um, it's important to understand, what they call complex grief or chronic grief, which is individuals having long-term sadness, anxiety, guilt, and other emotions that interfere with their day-to-day living. So, grief, mourning, bereavement, a lot of that is a very common theme in the field of counseling, and you certainly should be aware of those themes.